Before I do my head-to-toe assessment, I'm going to start by washing my hands. Just going to use this hand sanitizer. And can I please ask you your name, your birthday, and today's date?
Gabrielle Bell, March 22nd, 1995, July 1st,
How about the year?
2016.
Very good. And before we start our assessment, I'm going to tell you 3 words. And at the end of the assessment, I'm going to ask you to repeat back those 3 words to me. So, are you ready for the 3 words?
Yeah.
They are baby, bell, and apple.
Okay.
Ready? Okay. So first off, I'm going to ask you to close your eyes for me. I'm just going to assess your eyelids and the symmetry and the skin across your face, and everything looks very even and the same color. I don't note any lesions or abnormalities. Now, could you please raise your eyebrows for me? Could you give me a big smile? And how about puff out your cheeks? Very good. I was just assessing cranial nerve 7. Now, could you please stick out your tongue for me? Very good. I was just assessing cranial nerve 12. Okay, and this is just a cranial nerve assessment to make sure everything's working properly. So now I'm going to ask you, what is touching your cheek? Just tell me if it's a hard or soft object. Okay. Go ahead and close your eyes.
Soft.
Soft is correct, and that was just assessing cranial nerve 5. Now I'm going to check your field gaze. So what I'm going to ask you to do is maybe just sit up for me. And I'm just going to ask you to follow my finger in all 6 directions. This is just to check for pupil accommodation and fixation. Okay, I'm going to start in the middle. Ready? Very good. You could go ahead and sit back now. That was just assessing cranial nerves 3, 5, and 6. Okay, now I'm just going to pull your eyelids down from the bottom here. You can open your eyes. I'm just checking for any drainage or discharge or discoloration, and it looks like you do not have any of those. Now I'm going to move on to your ear assessment. You could go ahead and sit up for this part.
Okay.
Okay. So your ears look to be within the right measurement, 4 to 10 centimeters. I do not see any discharge. The skin is the same color all around, and there is no visible earwax present. Do you have any ear pain?
No.
Any ringing of the ears or discomfort?
No.
Okay, very good. All right, now I'm going to ask you to open up wide and say, I'm just going to use my tongue depressor. Okay. I was just assessing cranial nerves 4 and 5 and also checking for a gag reflex. Go ahead, stick your tongue out a little bit more. All right. Very good. Your gag reflex is present. Okay. Now I'm going to ask you to shrug your shoulders against resistance. Okay, good. That was very easy for you, but if it wasn't so easy, there might be an issue with cranial nerve 6. All right, now I'm going to go ahead and assess your neck and the nose of your neck. I just want to be straight on for this. Okay, your trachea is midline. I can palpate your lymph nodes. I am palpating your carotid pulse, very strong pulse, regular rate and rhythm. Very good. Now I'm just going to why is it off? Okay, sorry about that. We just had a mild camera issue. I'm just going to go back to palpating the carotid pulse. Now I'm going to listen in 3 different spots for a Brui while she takes a deep breath. Okay, go ahead and hold your breath. Okay, there was no Brui heard upon auscultation, and if there was, you would want to listen a little better. Now I'm just going to check for JVD, which is jugular venous distension, and that would just mean you were a little bit fluid overloaded. This is oftentimes seen in people with right-sided congestive heart failure. Okay, go ahead and turn your face to the left. And you do not have any jugular venous distension notable. And your, excuse me, your trachea and thyroid are midline, and I can palpate. Okay, do you have any pain upon palpation?
No.
No pain is felt, which is good. Now I'm just gonna check your skin. Can I just see your arm here? All right, very even. I do not notice any gross moles, lesions, or abnormalities. Okay, I'm just gonna check your skin. Good, that is a good sign that shows a good hydration status when your skin quickly returns from a tenting position. I'm just gonna check your capillary refill, which is less than 3 seconds, which shows a good oxygenation saturation. Okay, now if you don't mind, I'm just gonna place my hand upon your chest to count your respiratory rate. Act like I'm not here. All right. Very good rate and rhythm, and your AP diameter is normal, which is 2 to 1, and that just means, width to length is normal. Okay, I'm just gonna make sure our camera doesn't time out here. Sorry about that. Okay, back to the assessment. I'm now going to auscultate your lung fields. If you could just take a deep breath every time my stethoscope touches your back. These are just the bronchiovascular lung sounds, which are clear to auscultation, as well as the vascular lung sounds. Okay. The bronchial are the loudest lung sounds, the bronchiovascular are medium tone sounds, and the vascular are the low pitch sounds. Okay, now with my hand upon your chest, could you just say 99 for me?
99.
Okay, and that was just observing tactile fremetus, which if there was a large vibration while she stated the words 99, that could signify an overload of fluid status within her lung fields, but she did not have any present. Okay, now I'm just going to place my hand on your back and just do a little thump with my fist to see if I feel any dullness. Okay, none present, which is also a good sign. All right, now I'm going to move onto the cardiovascular assessment. I'm going to listen to all of your lung sounds, starting with the aortic. Very good. Moving on to the pulmonic. Now the mitral. Now the tricuspid. Okay, now I'm going to listen to the PMI at the fourth intercostal space. Very good. I did not auscultate any thrills, pulsations. Do you have any chest pain or palpitations?
No.
No? Okay. Very good. I used the diaphragm on my stethoscope, but I would have listened to the bell on my stethoscope to amplify the noise even more, but I heard them quite clear. You could use the bell if you were listening to someone that had some more adipose tissue to try and amplify it, but I could hear very clearly using the diaphragm on my stethoscope. Excuse me, now I'm just going to palpate other pulses upon your body. Could you just stick your arm out for me? I'm going to palpate the radial pulse. Very good, regular rate and rhythm. Now the brachial pulse. Okay, now I'm just going to see your foot here and palpate the pedal pulse. Okay, and I have the posterior tibia here, which is on the inside of the foot. Very good. All right, now if I could just ask you to lay down on your back across the couch here. I'm going to inspect your abdomen. Okay. It is an even tone. Do you have any abdominal pain?
No.
Okay, it seems very clear. I'm just going to now auscultate for vowel sounds. Just give me 1 second, sorry. Always start in the right lower quadrant. And you have to listen for at least 2 minutes to note that there are no vowel sounds present. Are you having any abdominal pain, distension? I do not palpate any distension, but do you ever feel distended, constipated?
No.
Do you have regular bowel movements?
Yes.
Okay, very good. Now I'm just going to auscultate once more for the aorta. You would, in some cases, be able to auscultate if the patient had, for instance, an aortic aneurysm, the renal and iliac arteries, femoral arteries. I'm going to auscultate. Okay, very good. Now I'm just going to palpate your lower extremities here. I'm going to feel the pulses of the lower extremities like I had done before, as well as assessing for any pitting or non-pitting edema, where I would grade it from +1 to +4 depending on its duration. You do not have any edema present. No swelling around your knees. Do you have any leg pain?
No.
Any muscle cramps, twitching?
No.
Okay, now I'm just going to look at the bottom of your foot here, and I'm going to do what's called a Babinski reflex. I'm just going to do an upside down J on the bottom of your foot. Okay, very good. That was non-reactive, and it's normally not in adults her age, which is a good sign. Now for the rest of the exam. First, I'm going to have you sit on the couch and dangle your lower extremity so I can check your patellar reflex, please. Okay. Very good. Very good. It's about a +2 strong reflex. Okay, and now I'm going to check you for plantar flexion and extension. Can you please push against my hand? Okay, now, how about this way? Very good. Now this foot, can you push? Okay, now I'm going to pull back and try to hold resistance. Okay, very good. Okay, now I'm going to have you stand up so I can assess your spine. For symmetry, I will assess your back. For coloration, to see if there's any abnormal growth, go ahead and bend over. Okay, very good. The spine is midline. There's no abnormalities. It could be things you would look for would be scoliosis when assessing the spine curve. Okay, now I'm just going to step aside and ask you to step back here when I'm going to observe your gait pattern. Can you just walk to the room this way? Okay, now can you walk back this way, but do heel to toe? Very good. Can you just rub your heel against your shin? Okay, I'm just assessing your balance and your posture. You could go ahead and drop your foot there. All right, and now close your eyes and stick both your hands out forward like so. This is the Romberg test, and I'm just testing for any deviation of the hands. You could go ahead and drop your hands. You did not have any deviation or asymmetry. Now, could you please just put your fingers out like this, and then just touch your thumbs to your fingers with your eyes closed. Okay, very good. You're able to do that. Now go ahead and have another seat. I'm just going to assess your range of motion. Can you just extend both your hands up over your head and now drop them down? Okay, that's very good. And now do the same, just extend your feet out. All right, very good, active range of motion. All right, and now to, just summarize the head to toe assessment, can you please repeat those 3 words back to me?
Baby, apple, bell.
Very good, and that is your head to toe assessment. Thank you very much, Gabrielle.